Hello, good afternoon. Sorry, my name is Arif Abdullah, and today I'll be going through my project for medical devices, which is apnea monitoring systems. So first off, what is an apnea monitoring system? They are intricate devices engineered to play a pivotal role in healthcare settings. Their construction integrates cutting-edge sensing technologies to ensure precision detecting and responding to respiratory events. A key component of these monitors is impedance pneumography, a method that detects minuscule changes in electrical impedance as air enters and exits the lungs. This technique employs two electrodes positioned on the chest through which a low amplitude, high frequency current passes. So, where you are meant to place it is like basically, hold on, give me a moment, it's like here, above the chest. So like right above, no, sorry, not above the chest, like here, right above the nipple, sorry. Yeah. This technique employs two electrodes positioned at the chest with, yeah, basically, yeah, that's what it does lah. So by interpreting impedance variations, the monitors can accurately discern breath. Notably, impedance tomography not only detects respiration but also monitors the electrical activity of the heart. That's why you placed it on the chest lah. In addition to impedance tomography, various direct methods of respiration detections are employed. Thermistors positioned near the nose or my mouth, or somebody's mouth, sorry. It detects temperature fluctuations as air is either inhaled or exhaled. Proximal airway pressure sensors and carbon dioxide sensors provide further avenues for respiratory monitoring. For instance, infrared CO2 sensors gauge the partial pressure of CO2 in exhaled gases. This comprehensive integration of diverse sensing methods ensure broad coverage suitable for different patient demographics and respiratory conditions. Next, we'll give a further elaboration as well for each direct method. For impedance tomography, as mentioned earlier, it relies on precise placement of the two electrodes to detect changes in electrical impedance corresponding to breathing patterns. Similarly, thermistors positioned near the mouth or the nose register temperature shifts indicative of respiration. Meanwhile, for the CO2 sensors, it often employs an infrared technology measuring the partial pressure of CO2 in exhaled gases, providing valuable insight into respiratory functions. This multifaceted approach for respiration detection underscores the sophistication of apnea monitoring systems. By combining various sensing methods, these monitors ensure comprehensive coverage across diverse patient populations, and respiratory conditions. From impedance tomography to thermistors and even CO2 sensors, each component plays a crucial role in facilitating accurate and reliable respiratory monitoring. Next, we'll go to the functions. For the first one, it detects cessation of breathing and triggers an alarm, which when a predefined duration without breath detection is reached. These monitors are equipped with a range of detection methods, enabling them to capture various types of apnea. Basically, there are three types, which is central, obstructive, and mixed. The flexibility of these monitors, sorry, extend to their settings, featuring adjustable bradycardia alarms and customizable sensitivity controls. The adaptability of these monitors is astonishing and it helps cater diverse needs of patients with different respiratory conditions. And even beyond this detection, the monitors incorporate additional monitoring modalities to provide a comprehensive assessment of the patient's physiological status. For instance, they can monitor one's heart rate, detecting both bradycardia and tachycardia, which are valuable indicators for potential hypoxia if the patients have it lah. Furthermore, options for monitoring blood pressures and hemoglobin oxygen saturation by SpO2 adds additional layer of patient care, enhancing the monitoring process. Additionally, the monitors are equipped with documentation capabilities, allowing them to record patients' event data, including including their respiratory and heart rates, as well as equipment data, giving us a power status and its battery levels. This record data serves various purposes, including verifying proper monitor usage. differentiating true alarms from the false ones, and troubleshooting equipment issues. Next, where can most of these monitors be found? So first off, it can be found in both either hospital or homes. For the hospital setting, particularly in healthcare, in intensive care units, these monitors provide continuous real-time monitoring for nurses and even doctors for patients at risk of respiratory failure. The modular and standalone configuration of these monitors make them suitable for diverse clinical setups, as shown in the slide lah. Sorry. For home settings, it's even better because it is there are some accounts there are some factors taken into account, such as portability and user-friendly interfaces. The reason why it could be used in a it could be used at home is because they are very indispensable for monitoring premature infants, individuals with respiratory control disorders, and patients weaning from respiratory suppressant drug therapy. Okay, okay. Given this unpredictable nature of apnea onset, continuous monitoring is essential, making it very suitable and super invaluable in home healthcare scenarios. Next up, we'll talk about our first problem statement. So our first problem statement involves the trauma to the patient's skin from the electrodes used in these monitors. This skin trauma can cause discomfort, and in several cases, it may lead to skin-related complications, which, as you can see in the horrific image shown at the bottom right-hand corner, yeah, it compromises the overall effectiveness of the monitoring system. Additionally, intentional disabling of the audible alarms and inaccuracies in rate meters pose risk to patient safety and the reliability of the monitoring process. So as I've just gone through for the alarm disabling, I will now go back to the last slide, sorry, because where we've missed one part. So for another critical for another problem that the apnea monitor system is currently facing is that one of its primary concerns for the potential for the monitors is that it erroneously fails to detect or alarm apnea episode due to artifacts. These artifacts may include vibrations from nearby instruments, such as patient movement, electromagnetic interference, or let's say even the patient fidgeting with, let's say the what the electrode is placed here, right? He would the patient would like fidget about cause maybe itchy or something like that, right? It could also it also be a key factor as it could be misinterpreted as respiratory signals, leading to false alarms or missed apnea events. Next, we'll talk about the discussion of the problem. So first off, for the artifact misinterpretation and skin trauma. For the for skin trauma from electrodes poses a notable concern impacting patients' comfort and safety. To address this issue, one improvement in electrode design is essential, with a focus on materials that are both effective in signal detection and it should be super gentle on the patient's skin, so as to not be too harsh or too hard on or sticky to a patient's skin. More Furthermore, the artifact detection requires the implementation of advanced algorithms for artifact recognition and rejection. These algorithms can enhance the accuracy of apnea detection by distinguishing between genuine respiratory signals and artifacts. Manufacturers should prioritize refining sensitivity controls, particularly for monitors utilizing impedance pneumography. Lastly, for the alarm disabling concerns, um, the intentional disabling of audible alarms undermines the purpose of the monitoring system and it jeopardizes one's safety. User education and awareness initiatives are crucial to mitigate the risk to ensure adherence to safety protocols. Next, for the solutions and recommendations, manufacturers should explore the use of soft and hypoallergenic materials for electrodes to mitigate skin trauma. Clear guidelines as well as proper electrode to mitigate skin proper electrode placement and periodic skin checks can ensure patient comfort and safety. As well as educational initiatives are essential to raise awareness among users regarding the importance of alarms and the potential risk associated with alarm manipulation. Sorry, comprehensive training on the significance of alarms and the consequences of alarm manipulation can promote user adherence to safety protocols, enhancing patient safety and reliability of the monitoring process. Addressing the artifact detection issues required the implementation of advanced algorithms for the artifact recognition and rejection. These algorithms can enhance the accuracy of apnea detection by distinguishing between genuine respiratory signals and artifacts. Manufacturers should basically prioritize these refining sensitivity controls, particularly for monitors utilizing impedance mammography. Another one is to ensure optimal performance of apnea monitoring systems. It is crucial to implement regular safe software updates. These updates serve to enhance the functionality of the system by incorporating bug fixes, security enhancement, and algorithm improvements. By staying current with software updates, it stays current by for healthcare facilities that can address any identified vulnerabilities and optimal artifact detection algorithms. This proactive approach to maintenance contributes to the overall reliability and effectiveness of the monitoring process. Next, what are some design considerations? First off, for designing apnea monitoring systems with advanced artifact detection algorithms, as it's fundamental to ensuring accurate and reliable detection in respiratory events. These algorithms play a critical role in differentiating between genuine respiratory signals and artifacts, thereby minimizing the risk of false alarms or missed apnea events. By refining these algorithms, the manufacturers can significantly enhance the performance of monitoring systems, especially in environments where artifact interference is super common. Additionally, employing a soft hypoallergenic electrode is crucial as it is essential for promoting patients' comfort and for their safety as well. Skin trauma from electrodes can also lead to discomfort and compromise the effectiveness of monitoring systems. Utilizing the gentle materials minimize the risk of adverse skin reactions, ensuring that monitoring remains comfortable and free through complications, particularly for vulnerable patient populations. Another one is for user-friendly interfaces, sorry, which are super indispensable for ensuring efficient usage in apnea monitoring systems. A well-designed interface with intuitive controls facilitates seamless customization of settings and effective alarm management. In basically high-stress situations such as emergencies, an intuitive interface reduces the risk of user errors and promotes swift and accurate adjustments. Moreover, user-friendly interfaces simplify the training process for newer users. So like basically interns doing internship in hospitals, as it ensures consistent and proper usage among caregivers. For maintenance of the apnea monitoring system, it encompasses several critical practices to ensure the optimal performance and reliability. Regular calibration checks are essential for maintaining the accuracy of sensing technologies over time. It ensures that the monitoring system continues to provide precise and reliable data on the foundational of for accurate apnea detection. By implementing routine calibration schedules, healthcare facilities can mitigate the risk of inaccurate readings and enhance the overall reliability of monitoring systems. Comprehensive educational support is equally vital to equip caregivers and healthcare professionals the knowledge and skills needed for practical devices usage. This includes understanding artifact recognition, interpreting alarms, and troubleshooting common issues. Continuous education ensures that users adhere to best practices, reducing the likelihoods errors of misuse. In addition to regular calibration and comprehensive educational support, implementing regular software updates is also very crucial for maintaining optimal performances in apnea monitoring systems. These updates include bug fixes, security enhancements, and algorithm improvements by addressing identified vulnerabilities, and optimizing system functionality. By staying current with software updates, healthcare facilities and can ensure that their monitor system remains up to date with technological advancements, enhancing overall reliability and effectiveness. Next, for the maintenance checklist. For the first one is regular calibration checks. So it ensures precise and like so to help maintain the accuracy of sensing technology over time. The calibration ensures precise and reliable data, foundational for accurate apnea detection. And then secondly for the comprehensive educational support. It equips users, basically doctors, nurses, as well as interns or even newer staff. It helps them keep up to it make helps them with knowledge and skills needed for practical device usage and maintenance. It includes understanding artifact recognition, interpreting alarms from the real one, from fake ones from the real ones, as well as troubleshooting some common issues. For the third one is regular software updates. So basically, what some staff can do is they are it, basically what they need to do is to keep a routine software update. So every time they do their daily checkup, they can double check to see if there's a software update for the monitor. So software updates include bug fixes, security enhancements, and algorithm improvements, addressing identified vulnerability and optimizing system functionality. By staying up to date with it, it also helps with technological advancements. Next up for the artifact recognition training is to educate mostly users on artifact recognition to maximize fake alarms and as well as optimizing apnea detection accuracy. For the last one, for the periodic skin sensitivity checks, we can what the users can do is conduct regular checkups and and adjustments to electrode sensitivity settings to prevent skin trauma as well as to ensure patient comfort. Next, based on the purchase recommendations by ACRI, which is ACRI lah, it's just ACRI. Based on their standards and recommendations, when purchasing a monitor, some healthcare facilities should prioritize accurate apnea detection and reliable waveform interpretation. This essential performance criteria ensures timely alerts, sorry, and to caregivers and clinically meaningful data presentation, enhancing patient safety as well as effective monitoring. For furthermore, adjustable alarms and breath rate capability are crucial features to consider when purchasing a monitor. Adjustable alarms enable customization to suit individual patient needs, while breath rate capability ensures comprehensive coverage across a wide range of respiratory conditions, which also helps enhance the monitoring process effectiveness. And in addition to actual recommendations, there are as well as other considerations as well. So one should consider the availability of home care services when purchasing the monitor. Home care services include easy setup, easy maintenance, as well as educational support for let's say uh, someone is in use of it, they can at least configure themselves. sorry, to help fit their need of their apnea monitoring system lah, and it contributes to effective home monitoring as well, which ensures patient safety as well as confidence to the caregiver. Another essential feature is documentation capabilities. Blood pressure and SpO2 monitoring options should also be considered when purchasing apnea monitors. Documentation capabilities facilitate data recording for verification and troubleshooting, while blood pressure and SpO2 monitoring options enhance the monitoring process capabilities, providing a super comprehensive patient monitoring solution. As shown here as well. So as well as interface and connectivity, it should opt for monitors with interface and connectivity, as I said earlier, to help with seamless integration as well as display and recording devices for data transfers to computers for comprehensive data analysis. Next, for the cost containment, which is I've changed it into optimizing purchasing decision and maximizing leverage, bargaining leverage. So one way to help maximize cost is to assess their clinical needs to identify essential features required for effective patient monitoring. Identifying essential features help optimize cost by focusing on functionalities and directly contribute to patient safety. Sorry, hold on. Furthermore, healthcare facilities can consider service contracts for maintenance cost containment. Service contracts may include routine software updates and preventive maintenance, ensuring optimal system performance while providing predictability. Sorry. Negotiating price for service contracts before purchase and exploring multi-year agreements can further enhance cost efficiency. This number one, I'm so sorry. So one way, so for negotiating service contracts and regular updates. For the first one, for pricing, for negotiating service contracts, one way healthcare facilities can do it is by negotiating pricing for multiple year agreements is which is a very prudent strategy for cost containment when procuring apnea monitoring systems. When they can, when and if they can secure a long-term contract, the healthcare facilities can potentially negotiate for lower pricing, as well as it provides cost predictability as well as budgetary stability over an extended period. Secondly, for exploring bundled service contracts offers another avenue for cost benefits in maintaining apnea monitoring systems. Bundled contracts may include a range of services such as routine maintenance, software updates, and technical support by the manufacturer themselves. So basically, not it's basically done firsthand by the company themselves and will do everything else for them. So let's say if there's a problem, instead of a hospital staff doing it, there'll be an on-site manufacturer from the manufacturing company which will help fix it lah. So by consolidating all these services into a single contract, healthcare facilities can streamline administrative process and potentially negotiate for a discounted price. Next, we'll talk about the evolution of the apnea monitors. So, it has evolved significantly since their inception, transitioning from a basic sensor to sophisticated monitoring systems. Early models utilized mattress motion sensors or string gauges, providing rudimentary detection capabilities. However, technological advancements has propelled the development of more advanced monitoring technologies, enabling more accurate and comprehensive respiratory monitoring. For as of now, monitor modern apnea monitors incorporate a plethora of features and functionalities beyond simple apnea detection. These include heart rate detection, which basically detects the heart lah, basically, as well as noise suppression technologies and automatic sensitivity adjustments and advanced signal processing algorithms. These additions enhance the accuracy, reliability, and usability of monitoring systems, catering the diverse needs of patients and healthcare providers. Next, what is the future of the apnea monitoring? The future trajectory of apnea monitoring is poised for further advancement, driven by emerging technologies and evolving healthcare needs. One anticipated development is the expansion of information channels and connectivity options. Future monitors are expected to record more data channels for extended periods, providing a more comprehensive understanding of patients' physiological parameters. Additionally, enhanced connectivity options will facilitate seamless data transfer and remote monitoring aligning with the growing trend of telehealth as well as remote patient management. Integration with emerging technologies such as artificial intelligence and machine learning holds immense potential for the future of apnea monitoring. Both algorithms can analyze vast amounts of patient data, as well as identifying patterns and anomalies to aid in early detection and interventions. These technologies as, have the potential to enhance the accuracy and efficiency of apnea monitoring systems, providing patient outcomes and healthcare delivery. In conclusion, basically, the apnea monitoring system plays a super duper crucial role in clinical significance, operational principles, safety measures and group practices, as well as user-friendly designs and education, future trajectory, and as well as the enhanced patient care and safety. For the clinical significance, it plays a crucial role in safeguarding patients at risk of respiratory failure, premature infants, individuals with respiratory disorders, and those undergoing respiratory suppressant drug therapy benefit from the continuous surveillance provided by these systems. Timely and accurate detection of apnea events is essential for preventing adverse outcomes, highlighting the indispensable role of apnea monitors in patient healthcare. And before that, due to time constraint, I would say thank you very much for listening to my presentation. Thank you, Dr. Fang, or whoever.